First off, an antidepressant is a drug used to prevent or treat clinical depression, and modern prescription antidepressants such as P.6 and Prozac were introduced in the late 1950s and have since been modified as they've been used more and had more testing done, but they were first introduced in the 1950s. And the controversy surrounding the subject of antidepressants in the military is that the antidepressants do more harm to the soldiers than they actually do good. And that's shown here in this video from Russia Today, which is a Russian news network. And although this is not a U.S. news network, they cover the point very well, and it's sad that other countries are reporting on this and seeing this is a problem, yet our own country is not. So that's kind of something to think about.
A record number of American troops are on antidepressants. According to the U.S. Army Surgeon General, more than 110,000 active duty servicemen and women are taking prescribed narcotics, sedatives, and anti-anxiety drugs. That's an 8-fold increase since 2005. Michael Brown served as a Marine in Iraq up until 2006. He started taking antidepressants after he returned from war.
When I was on the antidepressants, I couldn't make a rational thought. My brain was so cluttered with all this other garbage that was going on. My mind was wandering to 3 different points during the middle of a sentence. So, I wouldn't be able to make a decision on whether or not the person that's carrying the weapon in front of me was pointing it at me, or whether or not they were just carrying the weapon for protection.
Michael says when he complained of depression, he was given drugs before he even had the chance to talk to a doctor.
I was handed all the pills first, and then told that I might want to consider therapy or talking to a psychologist or a psychiatrist. It does seem that they push the pills kind of first and foremost, and then deal with everything else secondary.
My first argument is that antidepressants cloud the soldier's thoughts and judgment, and someone that's handling a loaded firearm for their job and at all times of the day should not be taking something that alters their thinking and their judgment when they could possibly be taking their life or someone else's life away. This is another clip from Russia Today and from the news story that I showed in the earlier segment of my video, and this just goes to show that the antidepressants really do cloud the mind of the taker.
American soldier David Lawrence was charged with murdering a detainee he was guarding in Afghanistan. His sentence was reduced to 10 years. It was proved that the psychotropic medication that he was prescribed made his mental condition worse.
My second argument is that the antidepressants are not doing their job in preventing suicidal thoughts. And this graph is showing that the attempts have risen from, in 2001, around 80 to 90 suicide attempts to, in 2010-2011, well over 150, which is almost a 100% increase in suicide attempts in 10 years, which is proving that the antidepressants are not doing their job the way they are supposed to.
Look at you, look at me, in this wild place, in this wild place.